So I'm trying to hook up.
You are muted, Commissioner Willie.
Now I'm unmuted?
Yes, you're unmuted now.
All right, well, then I could probably push.
All right. Madam Chair, we are ready to go when you are.
Well, welcome everyone to the afternoon of Tuesday, April 27th, 2021. This is Washington County Chair Catherine Harrington. And for today's work session, I'm currently joined by Commissioner Nafisa Fai, Commissioner Jerry Willie, and Commissioner Roy Rogers. And we are expecting Commissioner Pam Treese to join us shortly. So the first item on the agenda is board and leadership communication. Which commissioner would like to go first?
Oh, I'll go.
Great.
Thank you, Chair. Good afternoon, everyone. I don't really have a lot to report this week because last Tuesday we had our board meeting, and then Wednesday we had the Washington County Budget Committee. On Thursday, I did participate. Well, I did attend the Regional Congestion Pricing Study Panel Expert, and that was really enlightened conversation. I wasn't able to attend the whole thing or submit any questions, but that was really quite interesting, and it sort of validated the study that Metro did in terms of congestion pricing and the direction that Metro is thinking. So that was really good to hear experts sort of validate our plan and where we're heading, but also give us good feedback. I had with Commissioner Willie yesterday sort of budget briefing with our sheriff's office and our sheriff, Pat Garrett. I also participated at the Tualatin Valley Trails SAC meeting yesterday, and that was really good conversation. My first time being part of that committee. It was really nice to see a former commissioner for District 1, Dick Scouten, and he's also part of that committee. So that was really good. Yeah, so that's been what I've been up to, really, and sort of a lot of internal conversations.
Great, thank you. Any other commissioners with any board communication? Go ahead, Pam Treese.
Have I missed did everyone else go already?
Nope.
Okay. I'm just sorry there. I'm just getting my update pulled up here. This last week I attended the community action meeting, but just for a short period of time because we had our budget orientation that same evening. The discussion that I missed was about their point in time homeless count. So I'm getting an update about that on Friday from Kemp Shuey. I was gone on Friday and Monday, so it's been a relatively short week since just last Thursday. I am attending the MPAC meeting, which is this week. This is on the 28th, and I've got an update from Chris Defaba, and thank you to Chris for doing a great job in providing kind of a review of the agenda. I've looked at it, but she tends to give it a lot more flavor. So there's going to be the regional mobility policy update, and apparently this is the first briefing since the work plan was approved over a year ago. So there's a lot to be discussing there. The second item on the agenda is the 2019 Metro Natural Areas Bond Measure. So I think it's more of an update about what's happening with that. But I will be able to report next week, next Tuesday, about what happened at that meeting. So if there's anything that you're concerned about, please let me know. And that's my report.
Other commissioners?
Ma'am, I'm concerned about the tax rate on the federal side. Can you fix that for me?
You're talking to me?
Yep, you said you'd let you know about anything. So
I will do my best for you, Roy. For
Thank
you,
you.
Roy, I will.
I just read in Newsweek that with new increases, we'll be the 4th highest income tax state in the United States. So very interesting. This morning I was at a Rotary meeting, breakfast Rotary meeting that I spoke for about 35, 40 minutes. I always enjoy seeing Rotarians since I was one in the past. Tomorrow I have a elongated meeting. I'm speaking at something that's very stimulating to everybody on this call, and that's called the Oregon Municipal Auditors Conference. And so very enlightening, giddy kind of stuff. I mean, it's very detailed. Anyway, I'll be a speaker at that conference on the 17th or something, about 150 to 70 people in the audience. And usually somebody either from county or CWS attends because it's one of those real technical issues. Talking with Andrew a bit at Work Systems Inc. As you're seeing some of the information coming through, looks like finally, and I apologize for my political statement, but finally the federal government is allocating some more resources potentially. And the name of the game in poverty, as well as a lot of things, is job training, get people trained. And we're being encouraged to write letters and to do anything we can to encourage that appropriation of revenue. So anyway, that's what's going on immediately.
Wonderful. Commissioner Willie?
Well, good afternoon. Let's see, I'm trying this, like I said, I'm trying this on my new laptop from the county. So there's, it's certainly a different layout. So let's see, some fun things to talk about. I met with the North Plains folks on Monday with Matt, and we talked about their economic opportunity analysis that they're going through, and talking about industrial and commercial land possibilities. And so they've begun that process. I am leaving this meeting at probably about 2:45 today to attend a Genentech ribbon cutting for one of their newest buildings there. And so I will be gone for about 45 minutes probably or so. Next Tuesday, for all you baseball fans, is the Hops home opener next Tuesday night. So that'll be fun to start that series. They're going to have a 6-game series, and I think they have 12 games in May. So that'll be fun.
That's part of their long season or longer season this year.
Yeah, part of their new season. And I also heard from Mayor Callaway today that the Vancouver baseball team cannot play in Vancouver because they can't cross back and forth across the border. So they are also playing at the stadium out here in Hillsborough. So we've got 2 teams. So there's plenty of baseball. If you're into baseball and you want to go to those, certainly just go online. You can find out where your tickets are. They've done a great job, I think, of redesigning the ticket locations. So I don't know what percentage they are allowing into the stadium, but they've worked really hard to be in compliance with COVID and the distancing and all of that. So look forward to that next week. Also, I attended the chamber board meeting this morning, and they have a business survey that they are asking all the businesses to take about 10 minutes and fill out the business survey, send it back to them, and then they're going to provide that information to both the City of Hillsborough and to myself about what's the business's perspective of things. So if you are interested in a small business owner, I'd encourage you to log on to the Hillsborough Chamber and look for the business survey. It's actually it's www.surveymonkey.com, and then there's some other letters behind it. But go on to the Hillsborough Chamber website and you'll see it there. So take a few minutes if you would. That will help us when we begin talking about one of the areas that we can use the money to help businesses that we are going to get from the ARPA funds coming up. So I think that's it.
Great. Great. Well, our work continues. I want to thank Commissioner Willie for covering a meeting on Friday afternoon with Governor Brown, as both Commissioner Treese, Vice Chair Treese, and myself were away for long weekends. So we'll hear more about that. I forwarded to the board the governor's announcement of this morning as well. So when Marnie joins us, Marnie Kyle, during leadership communication with Ms. Angie, we'll be chatting a little bit more about what's happening there. So I've been in the same sort of meetings you all have been in. Wednesday night with the budget committee training, I thought Jack did a great job and made it fun for the various committee members as well. Then Thursday we had our roundtable and just a bunch of COVID interaction yesterday. So onward ho we go together. Tomorrow I'll be attending the WEA Board of Directors meeting tomorrow, and there's some information that I'll forward to you once the board makes a decision on all of that tomorrow. So the WEA board, that is. And I also want to thank all of you for your swift action on reviewing a proposed letter from AOC to the governor with regard to restaurant impact with extreme risk decision-making that she's making. So really appreciate your tending to that matter, and all of us have signed on to that. So that's terrific. Like you, I've received the Clean Water Services budget. I've gone through the various trainings that they've asked us to go through before we dive into reviewing the CWS proposed budget for the next fiscal year, and readying for the Washington County proposed budget. So just trying to make sure that, go through the appropriate due diligence for our policy and investment decision-making through the budget, but also trying to make sure that other events that don't have to happen between now and the end of June are left to that later time frame. So there is that. So that's it from me. Well, I have a couple of things for Alan, so I'll wait till he goes later. Ms. Angie, turn it over to you for leadership communication.
Good afternoon, Chair Harrington, Board of Commissioners. Marnie, thank you for being here. I actually want to give a few updates before we do talk about COVID, because there's other aspects of Washington County business we also need to focus on. So wanted to provide you an update just on the Wingspan held its first event this last weekend, the Reptile Show. There were over 8,000 attendees at the show. The event planners were expecting around 3,000. So this was a significant learning opportunity for staff because 5,000 additional attendees is significant also during COVID. They did have clear plans in place to ensure that safety within the facility was adhered to at all times. This included handing out masks to attendees that did not show up with masks. So that included 1,500 masks that were given out. Within the building, for high risk, the level was approved at just over 1,300 attendees, but capacity was never over 800. So we kept safety centered at all times. There was, with the sheer number of volume individuals waiting, pressures on event security, also cleaning, bathroom. And so staff are working on how do we continue to look at our processes. Some comments community members had expressed, it was great to attend an event and also to see the facility and be able to gather safely within the county's new investment. Last night, I sent the board an email on elections. I do want to lift out of that email, Ballot Tracks is live today. And so Ballot Tracks is the software where you can track your ballot. And so please see within the voters pamphlet for instructions on how to sign up for Ballot Tracks. So just want to express appreciations for the election staff to putting this feature into action this year. Dropbox locations, 4 limited hour Dropbox locations at library sites are in the process of converting to 24-hour, too many hours in that sentence, access for the May election. And those locations include Bethany, Chute Park, Aloha, and Beaverton at Murray Hills. Staff hopes to convert one more 24 access location by the time for the November election, and that includes Garden Home. And with that, I do want to open up conversation and questions relative to COVID from an employee workplace standpoint. We currently have 5 positive cases and 4 I cannot talk this afternoon. I need some more water. 4 close contact quarantine employees. This has been, I will say, an event-filled past few days as our statistics have increased. And I want to echo the comments of the chair that we need to ensure that we are focused on Washington County business at the same time that we're working through the response to COVID. What I'm alluding to is Treasury has not released guidance for ARPA funds yet. And the questions coming in from cities and other partners as far as how is the county going to allocate those funds, I have assured that we have a board subcommittee working with staff on what the strategy is, and the board will ultimately approve the strategy, and reminding our partners that this funding will come into the county in 2 tranches. And those 2 tranches need to extend through 2024. And within this funding, we still need to ensure that we're continuing our public health activities so that we can continue to move from response to recovery. And so from a funding perspective, for CRF funds last year, we received $104 million, as the board is well aware. And through the ARPA funds, we will be receiving in the 2 tranches $116 million, which is $58 million for each tranche. So knowing, as the board just received the annual report out for CRF, we need to really be thoughtful and strategic as we think about the allocation of these funds. So I did want to just circle back to that point if you are getting questions from partners within the community. And with that, Marnie, would you like to provide a very brief update just on COVID?
Sure. Thank you, Tanya, and Chair Harrington and board. So I'm starting with some good news. The governor announced today that Washington County will remain in the high-risk category, which is good news because there was a lot of concern that we were going to move into the extreme risk category again at the end of last week and over the weekend. So that's good news. And then I'm going to move to the cautious tale, which is our case rate was 192 per 100,000 The extreme risk case rate is 200 per 100,000. So I think I made a little bit of a joke and told Sia and Tanya it was by the hair of our chinny chin chins that we escaped being put into that extreme risk category. So in addition to the case rate, there is a statewide hospital bed metric, which is 300, and that was met at 319, and there has to be a percentage change from the previous 7 days. And our percentage change statewide was 37%. So that does mean that 15 counties, including Clackamas and Multnomah County, were moved to extreme risk because their case rate was over 200 per 100,000 and because the statewide metrics were also met. So, so that's where we are right now. And our focus is vaccinate, vaccinate, vaccinate. And please help us get out the word, because we are starting to see a little bit less demand for vaccines. We've increased our vaccination opportunities. So in addition to the federal pharmacy program and the Nike standing clinic and the Hillsborough Stadium, we've added 2 more standing clinics, one at St. Anthony's Church in Tigard and another standing clinic in the Hillsborough area, in addition to our what we call community kind of pop-up clinics, which serve very particular organizations, like maybe a work site that is a high risk for spread of COVID, or serving a population that's been disproportionately impacted. So there's lots of opportunities for lots more opportunities for vaccination, including bringing back J&J vaccine online. So we're really focused on getting those messages about the vaccines are safe and effective, and they are what is needed to get us out of these ups, dips, and valleys around risk categories and restrictions to our community. And with that, I will just be available for questions.
Commissioners, what questions do you have for our team?
And Marnie, this is Roy. How do you influence the calculation of the risk categories? Because in many other states, as you know, the risks are defined completely differently. So is this purely the governor and whatever she decides in her, I guess within her purview, or are there any ways to influence how those are calculated?
Well, there are differences from state to state in how they're defining risk, or how they're applying restrictions based on different metrics. But the metrics that we're using in Oregon are not uncommon metrics. The case rates and hospital capacity, test positivity, those are the most common rates across the United States. Whether or not different governors apply them is up to each individual state, but they're not uncommon. And I think, you of course can completely disagree with me, but from the public health perspective, it took a long time to get to these metrics, and the public health community is in agreement that these are fair metrics. Now, how you want to apply restrictions could be open for debate, but the metrics, although not perfect, public health is generally supportive of.
Would you also say, just to be crystal clear, we can all apply the same metrics, but we might have a standard of acceptability of certain instances being quite different? Like in Arizona, for instance, which I'm very familiar with, having kids there, they have metrics like you're talking about, but to them, acceptable risk is much higher than our acceptable risk. And so their economy is obviously much more open and much more booming. But is there any, again, not arguing how we get there, is there anything that any business or any elected official can do other than I guess continually send letters and just voice their displeasure with the governor's office. Is that all that's available? That's the, I guess, the biggest question.
I believe so. You probably know better than me, but I think that it has had an influence, and metrics, and the metrics haven't necessarily changed, but the tolerance of risk and the application of different restrictions has changed based on feedback from school officials, business officials, elected officials. So I think, and also as the science has informed us of varying risks. So for example, the CDC just reduced the nationwide guidance around outdoor wearing masks outdoors if you're not in a crowded area, if you're just outdoors by yourself or with other people that are vaccinated, that you don't need to wear a mask. So those kind of guidances change based on all of that, everything you've said and the science.
So I have a few questions, Marnie.
Mm-hmm.
One is that through correspondence amongst county commission chairs and to specifically an email that Yamhill County appointed chair Mary Starrett sent to the governor's office and to Pat Allen and Dr. Seidlinger, she brought to my attention that the number of hospital beds that the state reserves from hospitals across the state has been reduced. And then that runs into this threshold as she's defined for extreme risk and hospital utilization. And it seems to me that we know from the data and the charts that hospitals have more opportunity to adjust their hospital beds for COVID patients by rescheduling elective surgeries. And so I feel like it seems to me that we are being harmed. Our county communities are being the ones impacted by the governor's decision to change the hospital bed reservation system that she controls. So I don't know if I have the value of correct information or not. So that's why I sent you a heads up email with this to inquire about that. So what should we understand has happened?
So, Chair Harrington, thank you for the question. I will say I've been kind of scrambling to try to understand what the commissioner was asking about the hospital beds. I have talked to public health officials in Multnomah County, in Yamhill County. Also, I've talked to the Catherine Richer, who is the Rural Health Organization 1, Region 1 CEO, and several others, and nobody really understood what was being asked, because the governor does not control reserving. She doesn't reserve hospital beds.
Okay.
Now, at one point, she did include in her executive order, when we were going through a peak, she ordered the hospitals to stop elective surgeries. And the hospitals actually did that voluntarily before. Mm-hmm. And then as the cases went down, they resumed elective surgeries. And just as a reminder, elective surgeries include things like somebody that has been waiting for a knee replacement, or hip replacement. So it's not just like, I want my Botox or, you know, my.
Yeah, people are in pain. Yeah.
Right. So what's elective to us may not feel elective to other people. So just as a little bit of a reminder that that it includes a wider array. It's not just things that can wait all the time.
Yeah.
But so we were not clear about what was being asked there, and the governor has not set aside or ever mandated a certain number of beds be set aside for COVID patients or not be set aside for COVID patients. The only thing we've ever paid attention to is the total bed capacity and hospital capacity, which also includes staffing and medical supplies, those kind of things, and the number of COVID patients that are taking hospital beds and ICU beds, because they still have the need for their regular capacity. So I don't know if that helps, but
it does actually.
Good, because I was I'm not sure. So yeah, good.
Well, there's so many parts to the system. There's
Yeah.
so much data available. I mean, kudos to the state, right?
Yeah.
For trying to approach the ever improving knowledge base on this pandemic. But now there's so much data, I can't track it all.
Yeah.
So I have to ask for help trying to understand what is the latest. So that was the hard question of the three. They get, I think, progressively easier. So my second question relates to the case increase. And once again, my goal here is seeking to ensure I understand. So as we have seen increased case numbers here in Washington County, you and the other public health experts on your team, for which I'm grateful, have helped me understand that a lot of that case growth is in the age segments of 18 to 40-year-olds. And additionally, as Chair Kafori mentioned last night, that our public health teams, our tri-county regional public health teams, tell us that through all the contact tracing, that these case increases are not tied to restaurants and bars, that we're seeing a lot of the case increases through people socializing with families, friends, and others, whether inside or outside. You know, we're seeing the increase, particularly in that age group. And so what I'm struggling with, well, right now, Washington County isn't an extreme risk, but Multnomah and Clackamas County are, and they're our neighbors. We have people living and working and visiting and getting their everyday needs met amongst the three counties. It hurts to have any of the three of us move to extreme risk, knowing that you stay that way for 3 weeks. So I'm having difficulties understanding how the closure aspects of moving from high risk to extreme risk are really going to affect change in that case rate for the age groups 18 to 40-year-olds. Since it's not because of their visiting restaurants and bars, but extreme risk impacts most greatly restaurants and bars. So what am I missing?
Again, thank you, Chair Harrington. It's a really good question. I think it's a difficult question because it does feel like restaurants and bars are taking the brunt of the restrictions.
Bingo.
And you're right, we are seeing growing cases in the age group that are younger, in their 20s, 30s, and 40s. But what's really alarming is that what we're seeing in the hospitalizations is the younger age group of 30, 40, and 50. that are ending up in the hospital, including ICU, taking ICU beds. So that's really concerning. We are seeing the cases come from work sites and socializations, but it's really difficult to track it down to a particular restaurant or bar. What I can say is we're receiving a lot more complaints from residents about restaurants and bars that are allowing more people than the restrictions allow, and that they're allowing people to walk around from table to table or within the bar without their masks. And so I think that there's some concern that there could be more cases that are coming from that type of activity than we're able to track through our contact tracing, because it's really difficult to say that, you know, the infection came from this activity or group. Sometimes we can do that, but more often than not, we can list, you know, 6 or 7 high-risk activities that may have resulted in the infection. Even though individuals will often say, I got it from this, we can't often prove that scientifically.
Okay. So what, I think one of the, picking up on some of the phraseology used, don't walk about amongst other people without wearing a mask. If you're going to walk about, wear about, right? Wear a mask, wear about.
Yep.
Out and about.
Yes.
Okay.
And
Got
get
that.
vaccinated.
Yes, absolutely. Well, and hence my last question. So folks are getting fully vaccinated. I'm not there yet, right? So I get vaccinated next week, then it'll take, 2 weeks after that. So I'm looking at the end of May for myself, but some people are fully vaccinated. But what I've heard about from one of our own county employees is this employee has an adult child who got sick with COVID. And so the fully vaccinated employee was also tested and was asymptomatic, didn't have any symptoms, but nonetheless tested positive. And so that reminds me that even though you are fully vaccinated, you can still be contagious to others. So that's a good reminder for me and perhaps to others. But my question is, so I've heard news about how some perfectly healthy people with no health conditions have gotten rather sick. Some have recovered A-OK, but some have prolonged damage to their body, whether it's to their lungs or possibly for their heart or whatnot. And so I'm wondering if we know through the science yet, can someone who is fully vaccinated but asymptomatic end up with some long-term health problems?
Mm-hmm.
Or is that perhaps that to be explored territory, since our knowledge of this novel virus is still so young?
Yeah, so I think the direct answer is that is to be explored. It's one of the questions that I think the scientists are trying to understand. The vaccines are not 100% protective from infection. And if you're infected, even if you're asymptomatic, you can spread it. A couple of good news pieces in there. One is 42% of Washington County residents have received at least 1 dose of the vaccine. So that's great news. We're on our way. And the other good news is that there's only been about 156, something like that, number of documented breakthrough cases. So that is not who's ending up in the hospital. Vaccinations do protect you from being hospitalized and from becoming ill, but you still have to take precautions because we're still understanding who can still become infected and how you can spread that to others. That's still something we're learning about.
So it sounds like we have 58% of our population that we're still trying to reach to get vaccinated.
Yes.
Okay.
Yeah.
And that information on the county website, I haven't looked at the county vaccination page in a few weeks. Is it set up so that people can look at their own personal availability and find out where they can go any particular day of the week? Or do they have to pick and choose, like, the Hillsborough Stadium drive-through versus the Nike one, which operates, I can't remember when, versus a pharmacy?
So there's the list of pharmacies because we can't make appointments for the pharmacies. And for a lot of people, that's working great.
Yeah.
And then you can also sign up for, excuse me, one of the mass clinics.
Terrific.
It is still separate.
Okie dokie. Well, I'm still a little bit grumpy about this threat of extreme risk for not only for Washington County, but the impact to Clackamas and Multnomah County and businesses there. I've reached the end of my rope, so to speak, on that, or I've used the analogy of a rubber band, and I've been stretched to the limit and gone snap.
Mm-hmm.
It's been 13 months. Time to move on.
Well, next week I'll talk about the June goal. So there's a little preview, which will be good news.
Yeah, I've seen information on that.
Come on now, let's be optimistic.
Okay, 58% of the population, we're speaking to you. Please get vaccinated.
Yes.
And keep wearing your masks and stay healthy. Okay, thank you so much for your patience with my questions. And I'll turn it back over to my fellow colleagues to see if they might have any questions that they would like assistance with. Commissioners? Nope, just me and Commissioner Rogers today. Oh, go ahead, Commissioner Rogers.
Marnie, I've been asked, and I don't know if you have these resources, but for those in office settings, you'll see an email from me, who are trying to socially distance, and yet maybe they don't have the capacity to put people too far apart. Is there somewhere that they can come and get the best practices or standards and how to do that?
Yes, on our web page, there's a business assistance button, or I'll respond to your email too with a link. But our business compliance and outreach team can help them with all sorts of tools and information.
Just to repeat for the people who are watching this, where would they go again? And let's say they don't need to talk to somebody but want to do some reading. Can you, do you mind repeating it? Thank you.
Right, on our novel coronavirus webpage, there is workplace guidance. It's a great big square about in the middle of the page.
co.washington.or.us.
Yep, and then just go to novel coronavirus and then the big button on business workplace assistance.
I think that's it, Marnie.
Okay, thank you.
Thank you. Anything else, Ms. Angie?
Not today. Thank you.
Okay, thank you. Alan.
Sure. Well, good afternoon. I had a nice meeting with Tom Carr on onboarding for his taking over my role, and he's graciously volunteered to actually sit in on the interviews from my hiring process, I think, which should really help in getting some good candidates, knowing who their new boss is going to be. So that's it. And you had a couple questions for me?
Yes, thank you, Alan. Last week, I mentioned an outcome from a CFTL meeting, and you had previously mentioned an issue paper coming, and I'm just wondering a target timeframe for that, as all of us are trying to meter ourselves out through these budget weeks.
Yes, there is, as I mentioned last to you, is that there is no deadline for that amicus participation. And so I just heard today, I think that is sometime in late May. And so I will have something to you next week on that, sort of describing some of the issues.
Okay. And so colleagues will have that coming to us in addition to an email from Ruth Asuno on Friday with another policy issue paper that we're expected to consume. Okay, thanks. Just trying to keep track of all these side things separate from packets and budgets. Then the second thing I wanted to inquire about is I forgot to report to my colleagues that yesterday morning was the Metro Supportive Housing Services, SHS, Oversight Committee meeting. And the committee reviewed and discussed the Washington County SHS Local Implementation Plan, LIP, and they voted to recommend approval of our local implementation plan with some considerations. Considerations being different than conditions. So they're going to follow up. They discussed the considerations verbally, and they're going to follow up through Metro staff and our staff on addressing those considerations. Related to this, another aspect of the supportive housing services proposal that the voters approved was a tri-county program to look at infrastructure across the 3 counties. And after the measure was passed, the Metro Council took additional action and is referring to this as a regional committee. Now, 3 counties is what the voters approved. And so I'm wondering a little bit about how all of this is going to be effectuated and referred to through the intergovernmental agreements. So Alan, I don't know who on your team, whether it's you or someone else, we can count on for reviewing what the voters approved and making sure that before things get too far down the line, that our team, so legal as well as staff under Ms. Angie, is comfortable that what is being proposed for this tri-county effort follows what the voters approved. That's all.
And I know Paul Hathaway in my office has been working on that, working on the intergovernmental agreement, and I'll check with him. And I know a staff from housing have been there as well. And so.
Okay, because my chief of staff raised a caution flag on this. And so that's where I rely upon our expert Washington County team. That sounds terrific. Thank you very much. Appreciate it. Okay, commissioners, sorry to jump in the front of the line, but did any of you have any questions or comments of our legal team? No? Okay. All righty, Diane Taniguchi Dennis, Clean Water Services. What do we got for us?
Yes, thank you, Chair Harrington, and good afternoon, Board of Directors. We're in great stable operations with the treatment facilities and field operations, and in our natural systems group and all of our business group. Everyone's doing well. We do have a peak of a load of COVID exposures we're managing. There are some patterns in it. Some folks are dealing with COVID cases from their household members. Others are being exposed because of their friends. But I do have a cluster that we're managing at the Rock Creek Treatment Facility. One team member thought they just had normal seasonal, allergies, but it turned out to be COVID. They do live with 3 other roommates that also work at our facilities, and then 2 additional folks that are part of a friendship pod. So, so far they're all being tested to have come back negative. So we think we've dodged a bullet with just that one team member. But it is sort of 'tis the season, isn't it, with this increasing of cases. If any of you have any questions regarding the budget, we've received a couple, so the team's beginning to answer them. So I appreciate that if you just forward it to Mark Jockers or myself or Kathy, and we'll make sure that everybody gets the benefit of the questions and the answers. So thank you.
Can I ask a question about COVID and CWS? So with that sewer surveillance project, you had reported previously that you were seeing quite an increase of presence via the sewer surveillance, and we've had multiple surges to date, and I've not really thought previously about how the sewer surveillance may foretell if we've reached the peak and start to see things come down. So I don't really have a crisp question figured out yet. I'm more curious at this stage. Are we continuing to see increases, or are we starting to see the downward trend? Because the governor's office talked about how they anticipate that in 6 weeks, we'll be done with this current surge. And they're really putting a push on to be reopening Oregon by early June. So I'm just curious, if you don't know today, could you let us know in future weeks if the sewer surveillance project sees a downside on that peak?
That's a really great idea. We can prepare a privy council. We see the increasing caseloads about 2 weeks before it gets reported by people going in. It's just they're shedding the virus in their sewage. So we are still seeing increases. So I'll have Mark Jockers and the team do that. So I think we'll see an indication earlier that the sewage is dropping off. So that would be a great sort of indicator we could celebrate, I suppose, if we're starting to see it kind of coming over the curve. So I'll have the technical team do that. But it is good advanced sort of information. I was sharing with you when we were starting to see an uptick, and that was about 2 weeks before the human cases were coming in. So,
well, true to my nature, I'm looking for the silver lining in those continued dark clouds.
I'll have the team do that. Thank you, Chair.
Anything else for Diane today? Nope. All righty then. I see Commissioner Willie had to go off to the Genentech event. So without further ado, we do not have any changes to our business agenda for tonight. So just wanted to make sure that everyone knows before we go into oral communications, we will be taking a moment for remembrance of Congresswoman Elizabeth First. There's a short video, and then commissioners will have an opportunity to speak. So just remembering all of that. And so now we will move to the Salary Commission final report. And we have both the chair and the vice chair. of the Salary Commission. So welcome, please, the floor is yours.
Before we start, Chair, I just wanted to welcome our 2 Salary Commission members and also ask, thank you, Clerk Moss, for promoting also Steve March. As a matter of reference, the county has contracted with Steve March to manage this process on the county's behalf to ensure that this is an independent and also transparent process. Want to just on behalf of the staff team, really extend appreciation for Steve's quick responsiveness always and ensuring that we got to the finish line on time. In addition, we have 2 of the members here before you, Casey and Brianna. We haven't had the opportunity to meet before, so I'm not going to say your last names because I may say them incorrectly, but just really appreciate your leadership and your time in this process. And Alan, I think you wanted to make a couple comments based on questions that have come in, and then we'll turn it over to the 2 of you.
Thank you, Ms. Angie. So I just want to lay out some of the legal principles for the charter amendment, which set the salary commission. So the salary commission gets to set the salary for the Board of Commissioners. The county board does not get a say in that, and that's the way it was set up. And so, and that is, as Ms. Angie mentioned, that's why we had the independent salary commission, and that's why we hired an independent contractor, Mr. March. And so, as you know, for commissioners, there's no time clock you punch when you come in. You can either work 0 hours a week or 40 hours a week or 80 hours a week. And so the salary commission had to figure out what would be a fair salary based on what, the commissioners were working. So again, there's no obligation to work hours. I know there's been concern with commissioners about being part-time and staying part-time, and there's no obligation to work more hours than they need to get their job done. And so if you're part-time, you can stay part-time. But also there's no obligation to accept the salary. There's been a lot of precedent around the state about people saying they don't need the salary, they're not working hard enough for it or whatever, and so you don't need to accept the salary. So I just want to lay that out, and then turn it over to Casey and Brianna to talk about the commission.
Thank you very much, and thanks for having us this afternoon. I am Brianna Ekandon for the record, and I am the Vice Chair of Washington County's Salary Commission, and I'm going to present the first portion of information, then I'm going to pass it to our Chair, Casey. So the Salary Commission conducted we looked at several different factors to determine the salary and did a lot of research, and I wanted to walk you through that process. So we reviewed not only internal, but external comparators. And for external comparators, we wanted to establish an understanding of the market. For our internal comparators, we also wanted to understand what the internal compensation philosophy was for the county, as well as what the responsibilities, time commitment, and requirements are for county commissioners. We invited all of you to testify, and we really appreciated all of your input as we went through our process to determine the final salaries. Another key component that I mentioned earlier were the comparators. So a little detail around that is our external comparators, we included both Oregon and Washington and looked at counties that had similar population size as well as budget. And we assess factors like what services are offered, what are the sizes of the board and staff, and some other components to get a baseline of our comparison for Washington County in particular. In terms of an internal comparator, the role of the deputy county administrator was identified as the most similar internal comparator by us based on the scope of responsibilities, impact of position, complexity of role, and position in the organization. We were informed that there were some potential changes that were upcoming to some of the county positions. So we made the determination that linking the county commissioner salary directly to an internal position could potentially cause some inequities in the 2-year time frame. So we looked at both our internal and external comparators for that, and Casey's going to speak to that in a little more detail. Another component that came up quite a bit, and Alan just referenced, was the time of status. And based on the county charter, there is no hour expectation that was identified, and that was really something we felt was outside of our scope of work. So we really looked at the salary determination based on the overall work that's done by commissioners and the chairs for these sort of commissions. So I'd like to now pass it over to our chair, Casey, to cover the rest of our report. Thank you.
Thank you, Brianna. Hi, everyone. I'm Casey Koronek, and I'm the chair of the Washington County Salary Commission. So as Brianna mentioned, we were able to establish a market rate and also looked internally. We established the market rate by averaging the adjusted salaries of the commissioner roles in our comparator counties that we identified. Just as she mentioned, we determined that that would be the most fitting comparator to use rather than anchoring it internally. We did look at both options, and both options were also really similar in the outcome. It's just really looking forward over the 2-year period and looking at comparators that make the most sense in relation to the uniqueness of the role. The market rate really at this point was the best option for us to use. And so the average market rate was just under 115,000. And so we rounded that up to have a nice round number to 115,000 for the commissioner role. And then we also looked at comparators for the chair position. And as you know, in the past, the chair position was anchored to an internal position, and then the commissioner positions were anchored to the chair. And so instead, we really wanted to focus on that commissioner role and then looking at where the chair compensation should be set from there. Several counties in the comparators did not distinguish a chair, or if they do distinguish a chair, several of them, there's not any compensation difference. There are a couple of counties that handled it differently, either with a pretty sizable difference, but for really specific reasons, or a 2% difference. There was a county with a 10% difference. And just looking at all of the invited testimony and all of the information that we had and the comparators, we determined that setting the chair at 10% above the commissioner salary would be the most fitting, which places, as you see in the report, the salary of the chair at $126,500 annually. The next piece that we looked at that was really important is a COLA. And so just being consistent there, making sure that the a COLA is provided that's consistent with any COLA that is given to employees in the county administrator's office over the next 2-year period. So consistent in terms of the percentage that's applied and the timing of when it's provided. And so I guess that's our summary, and we would open it up to any questions that you all have. We're happy to clarify, respond to any areas we didn't hit on in our summary.
Commissioners, do you have any questions? Go ahead, Commissioner Treese, or comments.
First of all, I want to say thank you for your work, and I really appreciate the time and effort that you put toward this. Out of curiosity, my curiosity, what was the most difficult part for you?
Oh, I can take that on and pass it to Chair Casey. I think for us was really understanding our scope of work and staying narrowly focused on that and not letting all the other factors and nuances derail what we were set out to do.
I would agree with that. Just making sure that we are considering the right factors and staying on track. And I would just add really understanding the most appropriate comparators based on the role, because it is so unique, and different counties have different structures and handle the roles differently, yet the role in itself has a lot of similarities in different counties, but just trying to really unpack that and make sure that we had an accurate understanding of the work so that we were assigning appropriate compensation.
I keep pressing the mouse button. And seems like I have to do it twice. Thank you, Commissioner Treese. And to our salary commission members, I really appreciate the work that you put into this and looking at data sources, listening to interviews, asking questions. You did a really good job and I appreciate it. I do have a question to make sure that I've internalized your data sources correctly. So Moss, if you could help us bring up the charts.
Yes, Madam Chair, give me 1 second and I will get those.
And he reissued the packet, though it seemed like even though I downloaded it, I have to download the salary commission report to get a whole one page view of it. So it took me a little bit, and I'm not sure that I understand a couple of columns. And so I'm anticipating I might get a couple of questions. Oh, there we have it. So if we take this blue row and sort of in the middle, there's a column, budgeted number of direct FTE staff, and then budgeted number of indirect FTE staff. So I'm really going to focus on the 3 Portland metro area, area counties. So Washington County, Multnomah County, and Clackamas County, because we commissioners travel amongst ourselves, right? See one another in meetings and so forth. I had understood that for each of the, at least the district commissioners in Multnomah County, that they each had 2 full-time staff supporting them each. So that would be 8 people right there. And honestly, for the chair, she has a COO and other support staff. And so I haven't even thought about that. So I wasn't sure how to read those 2 columns for Multnomah County. And then for Clackamas County, I'd understood that each of the 5 members, the chair and each district commissioner, has 1 policy assistant per each of the 5. So that would be 5 right there. So that doesn't seem to jive with the information that this table's trying to inform me about. So I'm assuming I just don't understand the information or something altogether different. So can you help me understand that?
Yes, Madam Chair, and Steve, I don't want to cut you off at all, but so the budgeted number of direct staff, and we were fortunate to have a couple Multnomah County compensation folks on our team, so they helped us validate Multnomah County, and we did validation for the other counties as well. But the intention was to capture the direct report. Let me make sure I'm referencing. There's two different sections. One is focused on the chair role, and then the other one is on the commissioner. And we're looking at the commissioner role. So this is saying that there is one budgeted FTE that directly reports to the commissioner for Multnomah County. And then the indirect are any sort of direct reports that their direct reports may have.
Oh, so that budgeted number of direct FTE is for each of the commissioners?
Yes.
Oh, I thought it was total. Duh. Now I understand my mistake.
Great, thank you.
Well, I think I do. Often it's what I've heard summarized as a chief of staff and one scheduler. And so this is telling me that they may, in fact, have 4?
If I may clarify, having come from Multnomah County, so how they do their budgeted positions and their indirects, they sometimes float those positions around. So you may have a chief of staff, and you might share one of the other people with some other duty, so they don't budget it directly. So for example, we had one commissioner that was in charge of a summer work program, and they had one of their staff basically charged off to that summer work program. So what you see sometimes in the budget doesn't reflect the bodies in the office.
Okay, and I can get that. I can understand that because of a program association. But for multiple district commissioners, they've always explained to me that they have a chief of staff and a stable scheduler.
On average, that's correct. And so that one number one might be a drafting error, and we'll double check. But
okay, that would be helpful. And so also under Clackamas County, you're saying it's 2 per commissioner, not just 1.
Madam Chair, I can speak to that of previously working in the Clackamas County Administration Office. Each county commissioner does have one staff assistant that did everything, but they had also in the office, we had an administrative board assistant 1, a 2, and a clerk to the board, as well as some deputy county administrators that provided that indirect service to the commission. There was a combined effort to support the commissioners.
Okay, but 1 assistant for each of the 5 would be a total. It's just a different number. So this is where it just, that column isn't working for me.
it might have been too much information that we couldn't verify every data point.
Okay, so, okay, because what we have for ourselves is just our first iteration of the role in trying to make sure that commissioners are better staffed. And I know there are different struggles. Right now we have a model of 1 policy assistant across 2 district commissioners. So
yeah, I think the focus of the salary commission were on the commissioners themselves and their salaries, and they weren't as focused on the staffing to the staffing part. So that may have gotten skipped over a little bit.
Okay.
But on your hand, for your purposes, if you're now looking at what do we do with all this information, we'll make sure to clarify that information for you.
Okay, got it. Okay, that was all my question in terms of trying to understand this data. So I really appreciate your helping me with that today. So thank you, Kevin Moss, for sharing that data. Whoops, there we go. I lost my screen here. There we go. Well, job well done. So when does all this take effect?
I can respond to that, Chair Harrington. The next action before the board at your next board meeting will be acceptance of this report. And then the results of this report have already been included in the proposed budget that the board will receive tomorrow.
Okay. So Kevin, maybe after this meeting or before the next meeting, you and I can sync up on the work session packet experience that I've had to try and make sure that the packet that has the report and the attachments for next week is less clunky. And it could be user error too. He helped me earlier with working with the new iAgenda software. So that'll be great. Awesome. Well, seeing no other comments or questions, to you, Casey, and to Brianna, I'm sorry I've referred to you as your first names only. I'm afraid I would definitely mispronounce last names. So I don't mean any disrespect. So thank you. And also to Mr. March, thank you for helping us through the first ever experience.
Well,
You
thank you.
had a heavy lift this go around.
It was actually a gentle lift. You appointed, as you know, some wonderful professionals. They took the ball and ran with it. Every member of the Salary Commission, including the alternate, did some of the data work and the work on this and had input. So I just hats off to the Salary Commissioners. They did a great job.
Yes, you did. And it was all fully available. All your packets were available, your discussions and deliberations on YouTube. So I think that our community should be very confident in the quality of your work. Job well done.
I have a couple of comments. Nothing in regard to the panel. I think that you did the work. It was very narrow scope on what you had to do, and had to deal with what's comparable salaries, and that's fine. The issue I have is not one of the people who are elected, including the chair, was elected on the basis of understanding that it was a full-time position. And Alan, you've pointed out that there isn't any requirement to do that. So I'm particularly interested in what happens in adjustments when someone isn't full-time. I certainly understand in an election cycle, anyone who is going to step up and take the positions are going to understand it's a full-time position. Though I wish we had gone further and said you can't have any outside employment if you're going to take a full-time job. But what's interesting is I understand that in the next cycle, but for all 5 people who are currently elected, we need to have some thoughtful discussion on what it means to not take the full salary, how they do that, how they adjust hours and get some understanding amongst the board. Because I don't think, and you correct me, Alan, if I'm wrong, but this board nor any salary commission can change the charter unless they choose to change it at the ballot box. And it doesn't say that there's a time specific. So I think we need some thoughtfulness. But as far again as the salary commission, you had a narrow question of what should be paid, and you were looking at a full-time position. And so I take no exception to any part of your work.
And for the sake of our salary commission members, as well as the consultant, Mr. March, and any community members, when the Board of Commissioners talked about this topic back in 2019 and the struggles of working as commissioners for the large portfolio and how might we go about this, we did talk about how charter commissions work and how there can be direct referrals from the board as well. We discussed that again in 2020 as Alan, per request from Commissioner Treese, brought forward an idea for us. And we struggled with the reality that once a commission refers 3 items to the ballot, that's where the Secretary of State tends to say, maybe you should have had a charter review committee instead. So we opted to not wait for the years ahead, but deal with the challenges that we're currently facing with coverage. And so we were very clear and deliberate in advancing 2 charter proposals for the ballot in 2020. That referral was on a vote of 4-1, but the voters chose to support each of those charter items. And part of our board conversation is that we do anticipate that our various aspects of the charter will need to be revamped moving ahead. And we've already, back in 2019, we had had quite a discussion about the strategic plan as well. And we have committed with our new CAO to put together and advance a full-throated, if I could use that phrase, Washington County strategic plan process that will include community engagement. So I fully anticipate that there will be more exploration of this, and that includes potential exploration of term limits as well. And I've served with term limits and have a set of beliefs myself on the what makes for productive term limits, but there are various views on that as well. So, I'm not at all uncomfortable about the fact that as a board, we chose to address one of our challenges of time and making sure this is a family wage job sooner rather than later. But we do have some major aspects of this to come back to. So as our salary commission leaders, if you get any questions, do feel free to let community members know that your board has some future work to do. We know it. Eyes and ears wide open. Any other commissioner comments before we move on? All righty then. Thank you again. Appreciate all you've done for us. So the next item on the agenda is from the Office of Equity, Inclusion, and Community Engagement with Ms. Patricia Tillman. Kevin, if you could bring her up and the presentation, that'd be great.
Good afternoon, Chair Harrington and commissioners. Is it possible to also bring in Amanda Garcia Snell? She'll be co-presenting with me today.
She's coming right over for you, Latricia.
Okay, great. I'll go ahead and get started. So for the record, I'm Latricia Tillman, Chief Equity and Inclusion Officer, representing the Office of Equity, Inclusion, and Community Engagement. And I'm here today to provide the quarterly report on the office I'm going to provide you with some initial remarks to contextualize the work you are supporting. And then I will turn it over to Amanda Garcia Snell. She's our community engagement manager, to go through her team's part of the report. And then I'll come back in and give an update on the equity aspects of the work. And we'll have time for questions at the end. So let me go ahead and start with context. So next slide, please. Okay. So I want to begin the presentation with a reminder of both the context for this conversation and a grounding in the urgency and the mandate of this work. So equity, diversity, and inclusion work is all about two essential values: people and time. The 400-year legacy of slavery is all about the waste and disregard of human potential. And our task now is reconnecting ourselves and our government to the humanity that we have collectively lost as a result of the institution of slavery. Over the course of history, we have not taken the time needed to heal from the immense trauma that slavery and segregation caused, or to implement policies put in place to address the harms of slavery, including cutting short Reconstruction, not fully implementing our Civil Rights Act, or cutting short the war on poverty. Fast forward to today, recognizing that the staff most impacted by racism are the exact same people we want to engage in the work. We need to take time to allow staff who have endured past decisions and approaches that have been harmful to build trust, to be able to engage in equity work going forward. We want to take this seriously because people of color have been experiencing racialized trauma in work and outside of work. And we are learning that trauma, including historical trauma, gets manifested in the nervous system, our guts, and our muscles. And the impact of trauma, research shows, gets passed on across generations, not just in the way families or communities interact, but also to babies in utero and how our genes get expressed. Past and present trauma of experiencing discrimination, harassment, racialized violence, and racial inequities in all of our systems both confirms the legacy of trauma and compounds it with new evidence of its presence. That trauma keeps many of us in a state of anxiety, waiting for the next shoe to drop, in a constant state of fight, flight, or freeze. It impacts how we engage at work and at home for our self-protection and the safety of our children. We now see communities talking about recognizing racism as a public health crisis. This is about recognizing that we have not, as a country, a county, or community, fully recognized the health and psychological impacts of racism, and that we haven't taken the time and space to heal. The trauma of racism doesn't just impact the oppressed. It represents a chronic disease being passed from generation to generation across our entire society. And we all at some point have to stop and reflect on everything and wonder how white supremacy has played out in our lives, the lives of our ancestors, and how it is playing out in our lives today. Combating racism means we have to slow down and consider how our structures, processes, and timelines on autopilot often minimize the need to create safe spaces for staff and community to engage and reimagine the ways we need to work that center healing, safety, and our shared humanity. This brings me back to the concept of time and timelines and timeframes, and thankfully not all cultures think about time in the same way. What I want to introduce is some thought about the time horizon for this work and meaningful, measurable change. We do need to advance policy that centers equity, diversity, and inclusion. And that work is urgent to our diverse employees and communities. And we need to intentionally make sure that our timelines are not causing more damage to our most important resources, our staff and our community. So we want to center the idea of moving forward at the speed of trust. Next slide. So slowing down and being intentional about time and process does not mean a failure to progress. This is embodied in the work of the community engagement team, who are the essence of the Office of Equity, Inclusion, and Community Engagement. They're an example of moving forward at the speed of trust. This team has stepped into a vision that is pivoting towards centering equity, diversity, and inclusion in community engagement. Next slide. So I want to remind you of our vision for community engagement, which we shared in the original quarterly report. So this vision centers 6 areas of focus, and I'll just briefly touch on those. So focusing on improving how we collect and use demographic data, how we center culturally specific relationship development, how we work with you, our board, around practicing equity-focused community engagement strategies, how we invest in developing more diverse civic leaders, tailoring our recruitment for engaging culturally specific partners in filling seats on boards and commissions, as well as being active in our community participation organizations, and providing support to our community participation organizations and our boards and commissions so that they also can center equity, diversity, and inclusion. So this is our vision. And at this point, I will hand it over to Amanda, who will talk about the progress the community engagement team has made over the past quarter to live into this vision guiding our work. Amanda.
Thanks, Latricia. Good afternoon. Hopefully everyone can hear me. Oh, great. Okay, so next slide, please. So starting with board engagement, so this has been, this will be an opportunity to see how it, what the numbers look like in terms of providing support to you all, to the commissioners, and you, the chair, in terms of connecting with the community. And then also, I'll just show that in comparison to CPO participation to give you some overlay there. So next slide, please. So there's a lot going on in this slide. I'll unpack it a little bit. So this is it's a look back of 3 years for CPO attendance, and then last year and so far the board of the community engagement events that are associated with you all, with the board. So the blue bars are the board engagement events that we supported or hosted or participated in for 2020, and then the green bars are the 2 events that have happened in 2021. So as you recall, for 2021, we did the first quarterly town hall in March, and then the state of the county in April. So overlay that with the lines are CPO attendance, and each color represents a different year. Yellow is 2020. You can see that we've just had a couple of years of a couple months of CPO meetings, and so that's why it's flatlining for the rest of the year. And then we'll obviously see different participation throughout the year. And then you'll also notice that the gray line is 2020. So there was also a similar shape as we went into the pandemic until we were able to start doing virtual meetings and really get back to running. So really the idea with this slide is to just track the metrics and to demonstrate, the types of participation that the engagement events garner in relation to CPO meetings, just so that you can have a big picture in that regard. And then also to remind you that that we are also connecting to the limited English accessibility policy. So with the board engagement events, we're providing simultaneous interpretation in Spanish and American Sign Language, and then providing closed captioning to the town hall and State of the County on the YouTube video. And then I'm not sure if you're aware, but YouTube does do an auto translate into over about 100 languages for their the closed captions that are provided there. So that's another way that folks who read in another language can get the can hear your messages.
Amanda,
So sure.
May I ask a question on this slide, please?
Mm-hmm.
I noticed that both April and May are higher, and is that tied to election cycle? And that leads to my next question, which is, do we have any evidence of issue-related pushes for higher attendance, for example?
For CPO meetings specifically, is that your question? Yeah. Yeah, so prior to elections, we typically do candidate forums and informational sessions. And so we do see a bump in CPO participation in the fall, depending on the year, and then sometimes in May-ish time or April. It really depends on the CPO and what types of measures or how competitive the candidate pool is. And so in terms of other things of interest, we do track the topics and their participation. And so we can make suggestions to CPO leaders if we let them know, which types of topics get bigger attendance. And that's not necessarily hold true for every, what might be of great interest in CPO 10 may not necessarily be something that folks in Garden Home are very interested in, but it just really depends. And we see things like emergency preparedness is typically a topic that people have a lot of interest in. Many CPOs do have a lot of land use and transportation issues that are brought forward, but some of them focus on other things as well around food security or other, topics of interest in the neighborhood. Okay, next slide. So demographic data improvement. So as you may recall, with boards and commissions, there was, you all had interest in seeing more diverse participation in boards and commissions, as well as us as the community engagement and county leadership also wanted to see that. So this, this is an opportunity to see the change in the last quarter. And I want to start, before I show you this slide, because I think it's pretty exciting, I wanted to just really thank you for your leadership in continuing to ask about the demographic data when applicants are, with liaisons bring applicants forward. And then also let you know that there is language in the state statute that supports your ask in the fact that we can consider diversity and multiple criteria in our applicant selection and candidate selection. And so just really appreciate your leadership there and the impact that that has made. So next slide. So here you'll notice the big takeaway here is that in January of this year, 13% of applicants had provided demographic data. The 59 applicants that have submitted applications between January and April, 92% of them provided demographic data. So that to me is extremely exciting because we like to make data-based decisions. We like that to be one of the elements that we consider and look to as a metric. And so this provides us that opportunity. Next slide, please.
Can I ask a quick question on that? Go back to that slide. How do you get that without violating somebody's rights? Or secondly, if they think that they have to give it to be appointed?
So we have a pretty clear statement on the application that says you do not have to provide that information. And then it does tell people what we do with it. We do cite the Oregon revised statute that says that we can consider that among other criteria, consider how folks indicate their on the demographic questions among other criteria. So of course we cannot discriminate against people. We would not discriminate against people based on that. But we certainly can take that into account among the other criteria that we consider. And it's very clear on the application that this is voluntary, but that we appreciate people providing this information because it helps us reach our the goals that you all laid out in the resolution, in the diversity, equity, inclusion resolution. Okay, so as you know, we continue to support CPOs in the CPO program. As Latricia mentioned, we are shifting focus. So our priority for supporting CPOs is focused on increasing diversity and inclusion in CPOs and working with them to assure that there's a structure that supports representation of our entire community, and especially members from historically marginalized or excluded communities. So the data that I'm about to share with you was informed by an online survey that was open for about 3 months from November to March. We sent it out in a variety of formats electronically, and then we also mailed a postcard to folks that only receive mailed CPO notice or CPO notice via postal mail, so that they would have an opportunity to participate as well. And we received about 506 responses. So next slide. So this first slide shows the lighter turquoise color is the CPO responses, the survey responses, and then the darker blue is the Washington County population, and this is based on census data from 2019. So you can see that CPO members are identify significantly more white than the Washington County general population. But as you know, CPOs represent the entire community. And so definitely work there for us to do, and in working with the CPO leaders to increasing diversity, racial, ethnic diversity and participation. Next slide. So this is the age distribution of CPO members. And there's a couple of, just for space, those two smallest pink slices of the pie are the younger categories, folks that are 30 to 34, and then 25 to, and then less than 29 is the tiniest, or younger than 29. So here you can see over half of the current CPO members, the folks that responded to the survey, are 65 or over. And so that, of course, does not mean that we do not want to benefit from their experience. Of course we do, their experience and their knowledge in the community. But in terms of representing the entire community, there's work there too to figure out what is the best course of action and what are some strategies for really encouraging younger folks to participate in community participation organizations. Next slide. So this is the education level of CPO members in comparison to county population, general population, or folks who are 25 or older. So you can see quite a big difference in terms of the educational attainment of the respondents through the survey. And similarly, we value the participation and perspectives of folks with higher degrees of education, but we also would like to hear from other folks in the county and to really be able to represent and include the perspectives from people from all walks of life. Next slide, please. So income distribution. So this really highlights the historical critique of neighborhood or geographic-based engagement structure, that it's really, that participation there tends to be limited to older, white, educated, wealthier people, and other folks do not typically engage. And so this really shows us how we can be thinking about strategies to communicate and work with CPO leaders and to really be thinking about opportunities for that structure and how to be more inclusive of folks that are that are more representative of the median income in the county. Next slide. So language representation, I think we have really done a great job with ramping up to provide other language access for some of the board engagement events. But with the CPO meetings currently, the participation of folks, the respondents that provided this information, 2.8% of CPO members who speak a language other than English, in comparison to nearly a quarter of community members within the county that speak a language other than English. And so that to me says there's a lot of perspective that we're not getting by not offering or making it standard practice to have language accessibility within the CPO structure. Next slide. So employment status of CPO members. So here we have nearly 51% of CPO members are working, and 70% are, in comparison to 70% of the general population. And you'll also see that we have a large portion of CPO members who are retired. And so I think this is also reflective to some of the things we saw with the age distribution for sure. And I think it also speaks to some of the things that Latricia mentioned in the introduction around time and the way that we think about time. So in order to participate in a CPO, you need to have time to do that and need to see that as to be able to fit into the structure that currently exists. And that may not necessarily work for other folks. And so, or for all folks in the county. And so we're really, I think, looking to some of our virtual engagement opportunities to see how has that changed participation, and really, dive into that as we move forward, because I think that if someone has internet access, that certainly opens up more opportunities for people to be able to participate in virtual community engagement processes. Next slide. So home ownership, 6% of CPO members are renters, and in comparison to 38% of the county community members are renters. And so this also speaks, I think, to similarly the historic critique that I mentioned earlier, that really CPOs are something that homeowners or property owners would be interested in and would not be of interest to people who do not own property. But certainly the land use and transportation focus that many CPOs tend to have, and that structure was initially built around, those decisions impact entire communities, right? Not just property owners. Land use and transportation decisions and impact access to all kinds of goods and services, and definitely speak to people in different incomes and family structures, et cetera. And so I think this is some very telling statistic around what the participation in CPOs looks like in terms of the representation of the entire community. Next slide. So this is, these next two slides are informational. Really, I don't have a comparison to the broader community to share with you, and that's mainly based on how the census categorizes their data. So you'll see the gender identity, the split is similar to what we would expect for the broader community, but maybe not necessarily completely representative. And then there is some suggestion that the sexual orientation is not representative of the broader community and underrepresented for sure in terms of LGBTQ+ participation. Next slide. And same here, also informational. I don't necessarily have a comparison with the broader community, and that's primarily based on the way that the data is collected. But we do know that the CDC does say that nearly 25.6% of adults have some type of disability. And so you can see that we're probably not hitting the mark there either in terms of representing the entire. Next slide. So Then circling back to boards and commissions. So I wanted to say that we are, we have similar challenges with the data, the demographic data, as you have seen a little bit in the past with boards and commissions that we do with CPOs. We are working with boards and commissions liaisons. We're reviewing our discrimination and harassment policy, and we'll be looking to provide trainings to liaisons and to boards and commission members on how to support and advance equity, diversity, and inclusion. We are also, one of the Equity Leadership Council committees is focused on boards and commissions, diversity and inclusion best practices. And so once we are preparing to launch that, and once we get there, I think that will hopefully impact the diversity on our boards and commissions and the representation that we have. Next slide. So this is, we wanted to just show the Q1 change in appointees in some of the demographic information for boards and commissions. So I think one of the things that this really demonstrates to us is that we have better data, so we can provide better metrics. We clearly have more age diversity, but less racial diversity. And so we continue to be looking at this data, and that will inform our practice and our strategies, the types of trainings and conversations that we continue to have with liaisons in the community. Let's see, and next slide. So our civic leader program, we are nearing the completion of the 5th year of a contract with Adelante Mujeres, who's been providing the curriculum. We've been contracting with them to provide the curriculum with the civic leader program. And as you may be aware, it has grown. We started out with one cohort a year, and we're able to, because of the interest, we're able to expand that to 2 cohorts a year. Next slide, please. And so we have just completed our 6th cohort in March, which was held virtually. And I think we did report to you on the last update that our 5th cohort was actually modified because of the pandemic, and it was our first virtual cohort. And so it was really like a Civic Leader Advanced or 2.0. You had to have participated in a first a Civic Leader training session before you could participate in that second version. So we typically have about 20 to 25 participants in each cohort, but that's why we've had 6 cohorts and 103 people instead of closer to 120 people that have graduated. But of those 103 people, 16 of the 18 applicants that have applied for county boards and commissions have been appointed. And then we do know of 3 civic leaders who serve on boards and commissions of other jurisdictions or in elected office, either in a special district or another jurisdiction in the county. And so we're very excited about that, and definitely see this, this as one pathway to civic leadership. It isn't always straight, but we are exploring how to coordinate with other jurisdictions in their civic leadership training programs. And as we explore what our next civic leader curriculum will look like and what the class sessions will look like, we'll be opening that opportunity up to other vendors in the county, and to see what ideas community-based organizations have about leading the civic leadership training program. Next slide, please. So culturally specific relationship building. So this is really about the structure of our internal office and the community engagement program coordinators on my team. So next slide, please. We have next slide, please. We have looked at our long list of community partners that we have, that we send communications to, but still have a lot of work to do there in terms of relationship building, and have really tried to rethink how we're reaching out to folks. And so now each of the community engagement program coordinators serve as a point of contact for culturally specific communities, and also industry focus. And so really trying to spend the time and invest the time and the energy in intentional and authentic relationship building, and then also think a little bit more creatively about who are we connecting with, who are we reaching out to, and who might we be missing, and really trying to cast a wide and what I call a wide and dense net. So really trying to make sure that we're reaching broad community-based organizations across the county, and really trying to make connections with folks we haven't connected with in the past. So we are also leading some of the culture. Oh, could you go back one, please? Thanks. We're also leading some of the Cultural Heritage Month acknowledgements. So as you know, we did Black History Month in February, Trans Day of Visibility, and then also we've started the process for Land Acknowledgement and Native Heritage Month. And so we're really looking at land acknowledgement as this is an opportunity for us to build on the Native Heritage Month connections and relationships that we made last fall, and to really reach out to those members of Indigenous and Native communities, and start a dialogue with them about how can Washington County consider land acknowledgement, how should we be looking at this, how should we be thinking about this, and what are some of their thoughts. And so we will be bringing you an update on where that process is at in the summer. We've had the first committee meeting, and we're pretty excited about how that is shaping up, and be happy to share more of that with you in this summer. And then we're also preparing for Asian Pacific Islander Heritage Month, and then starting to talk about a Juneteenth celebration as well. So these are more opportunities for relationship building, and more opportunities for us as a county to demonstrate to communities that they are important, and that we want to honor their experience, and to really develop some meaningful relationships, and really think about ways that we can support and honor them in ways that we haven't in the past. And next slide. So we've also launched what we call the Season. It's the Community Engagement Staff Network, and this is staff from across the organization who represent from different departments who conduct community engagement in some fashion in their line of work. And so we're really trying to align some of those efforts. So the hope here is to have some standards of practice that we do as a county organization, and then really to not burden community-based organizations by coming to them in different ways across the organization, and not really having the right and the left hands talking to each other. And so our hope here is to just really bring together those internal staff practitioners, and make sure that we are doing our best to effectively and somewhat efficiently engage with community without overburdening them. And then finally, or lastly, for community engagement, we have started an assessment of digital engagement tools, and there are so many out there. We have really been taking advantage of all of the virtual conferences and meetings that our colleagues and other jurisdictions and organizations and counterparts are hosting, and to really watch, to experience those tools from the public facing side, and to really see what types of digital engagement tools we should be looking at as a county to have a broad and equitable reach. And with that, I will pass it back to Latricia.
Great. So thank you so much, Amanda, and your team for all of your great work. And in addition to the great work of community engagement, we have engaged in a range of what I'm calling foundational activities over the past quarter. Next slide. So circling back around to timeline, just wanted to, again, sort of recontextualize the work that we've been doing as an Office of Equity, Inclusion, and Community Engagement, recognizing that the resolution was passed just over a year ago. And I have now been here at the county for just over 7 months, and really working hard with our team and others to make sure that we're hitting the various milestones that were specified in the equity resolution. Next slide. So just want to provide a brief hiring update. We're really happy to have welcomed Kitty Kong to serve as our first supplier diversity coordinator. This was an internal hire, and Kitty was working on the procurement team, and so represents kind of the best of both worlds in terms of her connection to Washington County's diverse community and small business community, as well as really understanding our contracting and procurement processes. Our equity policy manager hiring is in its final stages. And so we should have really good news to announce over the next couple of weeks. And our civil rights coordinator and data equity coordinator positions now are both open for recruitment. We had to reopen both of those. In terms of the two positions that came to the office through the funding for supportive housing services, we have a temporary community engagement coordinator, Ty Schwefferman, and who's been doing a great job. And the permanent position, we just did final interviews for that role today. So again, we'll have some really good news. And the Senior Housing Justice Policy Coordinator is currently open. We extended it, I think it may be an extra week or so, to make sure that we had a really robust candidate pool. So I just wanted to mention that when people see Washington County hiring for positions like this, it shows how we're living into the equity resolution, and it creates a great deal of excitement from here, Washington County, the metro area, the state, regionally. And we've heard of people locally being forwarded jobs from places like Houston. So we know the word is getting out about the great work and the innovation that Washington County is taking on. Next slide. So here are just some of the elements of work. These are running kind of parallel to the elements of the equity resolution, just ways that we are starting to operationalize equity, diversity, and inclusion within our COVID response, within supportive housing services, and in our work with the government relations team, building equity into our legislative process, as well as into our budget process, and thinking here of budget as our major policy process. Next slide. We are doing some preliminary assessment work related to Title VI and Title VII of the Civil Rights Law. So that's related to client civil rights as well as employee civil rights. And then have been coordinating with facilities on an ADA assessment. We'll be able to share information about that in the next quarter. And then moving forward with the implementation of our limited English assistance policy. And I just want to say, again, back to the original comment about time, it really does feel to staff like a huge lift related to implementing civil rights law, and it is. And I just want to note that we are looking forward to 2024, which will be the 60th anniversary of the Civil Rights Act, and really want to be able to come into full compliance and be able to share very broadly, make sure that at every level of our organization and with our boards and commissions and community partners, that everybody's really fully trained up and engaged with how we can bring the Civil Rights Act into full fruition. Now that Kitty's on board, we are really diving in with this additional capacity in our office into equity and our procurement policy. So those updates will be coming soon to the board. And then we're starting to kind of frame some early conversation with the board and seeking your guidance around how we can or should we engage with the Construction Career Pathways Project, which is affectionately known as C2P2. And then we're continuing to start to build out work around equity, diversity, inclusion training. We're really excited about the new hire of our learning and development manager, Brianna, I'm not remembering her last name, but the brand new learning and development manager who just came on board, very excited about her skill set in advancing opportunities for equity, diversity, and inclusion training countywide.
Latricia, it's Brianna Taylor.
Brianna Taylor, I would have gotten it wrong, so I'm glad you, thank you for adding that in. Next slide. So again, centering on the equity resolution, my efforts in this quarter and moving forward with new staff joining the office will be on launching the two bodies that the resolution established, the Equity Leadership Council. We did launch that one in February. We're on the verge of launching the 6 committees established under the Equity Leadership Council. And then the Advisory Council on Racial Equity. That one we hope to launch by July of this year. This is the graphic is basically a draft equity, diversity and inclusion, community engagement, strategic action plan. Again, what I wanted to do with that, the draft plan is really to center the foundational work that we need to put in place over the next couple of years to help position us for a strategic plan, which would be much more community involved and with the intention of more transformational work that reflects community priorities. You can go to the next slide and then go ahead to the next one. So the draft plan has been shared with the board. I'll come back around to it at the end of the presentation, and I'm just about at the end. So this slide provides a little bit more information about the Internal Equity Leadership Council. It was launched in February, meets quarterly. We established 6 committees. About 99 staff members will be seated on the 6 committees. And we had an amazing response from staff who wanted to participate more than we had space for, and many of whom are also engaged and very excited about their own department's equity teams. So there is opportunity for everyone to engage in equity work, if not on the Equity Leadership Council within the departments. Next slide. As I mentioned, the External Advisory Council for Racial Equity, that's in development. We are focusing on a structure that is really about centering community voice, co-creation, power sharing, and we're looking at a July launch. And then I want to close just with a brief discussion and question for the board. So again, given the time constraints of the equity resolution, which speaks of adopting an equity strategic plan in August of 2021, what I shared with the board was an equity strategic action plan. And I, again, want to differentiate a strategic action plan, which is focused on foundational work for the office and getting kind of our internal house in order, from a strategic plan, which would be community involved with the intent of being transformational. So the key question for the board here is, would the board support adding a discussion of the strategic action plan at a work session in July? And then that would set us up for the potential of adopting it at a board meeting in August. And my intent is really to make sure that we are meeting that milestone that was outlined specifically in the equity resolution. So that's all we have to share. That's my question for you, but also want to make time for your questions for me.
Commissioners, any questions on any of the slides in the presentation, and or definitely thoughts on the key question? Commissioner Rogers.
I don't have one on the key question here. That's I'll let the rest of you deal with that. But Amanda, I'm curious. having seen us spend millions and millions and millions over many years on the CPO program, and seeing that the results of participation is different over those many years, it seems to be on a little bit of an uptick. And I have, I guess, a little judgment in my mind, which may be inaccurate, but that has to do a lot with people being able to not have to have their bottoms in seats at a meeting, but having some kind of access through the internet. And so I'm curious what sort of resources and time we're going to devote to continuing that process. It doesn't matter to me whether there's a pandemic or not. I think that fosters a lot more participation. And the second one is that, frankly, I don't know how to say this very delicately, but some CPOs, if you get 10 to 12 people there, that's not, an unusual event. So it would seem that for our costs and to better prepare for meetings and have better participation, would it make sense that we have some sort of a continued dialogue about consolidating CPOs so that there'll be a critical mass that can actually come to these things, and that it's just not in my own backyard. I have an interest, but maybe it's the backyard a few miles away. So 2 questions. One, can we think outside the box on continued participation electronically, digitally? And second, is it time to have the hard issue that I can't have an outpost in every area if nobody comes to the outpost? Maybe I need to consolidate a little bit. So anyway, that's my 2 questions.
Sure. So for your first question, yes, absolutely. I agree with you. I think that the increase in participation is about the virtual option and this, folks being able to do a Zoom meeting. From my own personal experience with I live in the city of Portland, have a neighborhood association, and can participate via via digital platform, and that helps me. I have a child at home. I'm sure I'm not the only person that's in that boat. And so, yeah, we definitely plan to continue to offer a digital engagement option. We're considering, what does that look like to offer hybrid meetings? Right now, the hybrid meetings that we do, we have to do them in the county building. It's not particularly convenient to CPOs. And so, so definitely thinking about what is the infrastructure out in the community, because that's where the CPO in-person meetings happen, in community, in community spaces. And so really needing to think about how can we bridge that gap to be able to provide online or digital, option for meetings that are in the community. And that's part of our exploration for the digital engagement tools as well. To your second question, one of the things that I have noticed, and thank you to Ken Rencher and Land Use and Transportation for providing this information to me, but we looked at the population numbers within all of the CPO districts, the boundaries, and there's a very big difference there. Some of them have 1,000 people, some of them have 89,000 people that live within those boundary areas. And so the more I learn about the history of how the CPO boundaries were developed before my time with the county in the 80s, not before my time on this earth, but certainly before my time as a working person, it seems clear that we are at a place to be thinking about that. And I would, one of the things that I have been saying to folks is that I would like to see the census, I'd like to see the decennial census results before we start having that conversation, because I think, that is tied to a larger conversation. I also, I think as you are aware, the CPO boundaries do not align with commissioner districts. And I think that creates some confusion, and since those boundaries seem to be developed somewhat arbitrarily when they were first created, I think there's a lot of opportunity there to be thinking about how are those boundaries determined, and start having that conversation with CPOs. And some of them are very much interested in having that conversation as well.
I'll throw out one more sacrilegious comment, and that is that some of the cities have asked if there isn't some mechanism to combine activities because there's general interest in the area. Things that are done aren't just pertaining to an arbitrary line in the sand. So if you do that, and I don't disagree with anything you've said, the census and taking a look at it, and it does seem a little odd that some of them are geographically only maybe a few thousand people, and others are huge in terms of many, many, many thousands of people. Take a look at the cities as well, because I know I've had that question in my neck of the woods before. Why can't the county combine with ours? And we'll have a fruitful discussion, because it's literally many times the CPO is on one side of the street and the city's NACs are on the exact opposite side of it. And they're in the same neighborhoods. They have the same issues. So anyway, just thoughts.
Thanks. And I was just going to add one thing, that in some areas we do have multi-jurisdictional entities come together to share the CPO. So in their law enforcement updates that they receive at the beginning of each meeting, it's typically all of the law enforcement jurisdictions that that do work in that, within that boundary, come and share updates and information, and same with fire and rescue. And so that is definitely something that I think is worth more conversation for sure. Sorry, Latricia.
Yeah, let me just add to that the goal, the data that we shared today around the lack of diversity within the CPOs is not unique to Washington County. It is something that multiple civic engagement types of structures have struggled with in our city, in our state, in our region, and nationally. And so for us, the question is not just about more engagement, it is about more equitable and inclusive engagement. And so just combining structures to increase participation is not going to be sufficient if we don't also see an increase in diversity and inclusion. And so I think of it as really a both and kind of proposition for us going forward.
Commissioners, any other comments or questions, particularly on the key question we've been asked?
It was a great presentation. The data was really interesting. A lot of it confirmed what my experience has been with the CPO structure, but a lot of it was just, I didn't realize the extent of the gaps in some places. I'm in support of a July work session that focuses on the strategic action plan.
Commissioner Fye and Willie? Commissioner Fye is thumbs up. Commissioner Willie is thumbs up. Chair Harrington is thumbs up. This was great information. If perhaps Ms. Angie or Mr. Rapplier could help me out with this. So I'm not sure if through the announcement yesterday, if the census released the US Census released all of the information we need or just a subset. Can you help me understand that?
So there's a staff,
TBD.
TBD. Staff are looking at that to examine what that means as far as what information is available now.
Yeah.
And then
I imagine they could have released just state level information versus all the counties in the whole country.
Mm-hmm. And Chair Harrington, I do want to indicate I appreciated your name slip, because I want to acknowledge I made a name slip prior. It's actually Brianna Jackson, not Brianna Taylor. And so I do want to acknowledge that, as well as indicate she is our new training and development manager. This is the first Training and Development Manager Washington County has had. The position is within our HR department. Brianna, it has been meeting with Latricia and her team and will continue to meet with them as well as others within the county, and is working on a training and development strategy, which we will update the board later this fall. And so that will be presented by Eva Labonte, our Chief HR Officer, as well as Brianna. So I just wanted to make that quick correction.
This was a wonderful presentation. Thank you, staff. I learned a lot, and I appreciate Ms. Tillman. Really, you've only been here 7 months? That's a lot of impact in 7 months. And wow, I'm very impressed. I'm thrilled, of course. And I really appreciate how the community engagement team is involved and integrated with each of the departments as well. Because outside, we're seen as one agency. We are one Washington County. And I appreciate the very thoughtful manner that your team and all the departments are going through. As Ms. Tillman has helped me understand, our journey for equity is just that, a journey. And while I'm in some ways, I know that time is like that sand that goes through our fingers. And as we, the political head of the agency, as the Board of Commissioners, we're elected for 4-year terms. My sense of time is influenced by that context. And as I know Commissioner Treese can relate, here we're not even quite 2.5 years into our first term and we're already running for re-election. It's like, wow, wait a second, how did we lose that time? So time does go by. So thank you again for all of your thoughtfulness and care on this journey. And we'll look forward to our engagement in July and the next quarterly report as well.
Well, thank you, Madam Chair and Commissioners, as well as Tanya, Department Directors. Your continued leadership really helps us lean into a new era of trust and engagement, and that will serve us well as we continue to operationalize the equity resolution.
Terrific. Thank you.
Thank you.
Which takes us to another community engagement aspect, the Developmental Disabilities Advisory Council appointments. So we'd like to welcome Colin Fitzgerald, the Developmental Disabilities Division Manager. Hello there, Colin. Welcome.
Hello, and good afternoon, Chair Harrington, Board of Commissioners. The Developmental Disabilities Advisory Council is a 15-member council that serves in an advisory capacity to the Washington County Department of Health and Human Services. The council provides input on program development, planning, monitoring, and funding issues. The council meets 1 time a month at an agreed upon time. This past year, all meetings have been virtual on Zoom due to the pandemic. Members of the DD Council are recipients of service, advocates, professionals in the field, provider representatives, and family members. Positions on the council are not specified in our bylaws, but current council members are focused on building a council that includes a diverse and broad representation of our Washington County community. A priority of the council this year is to raise awareness to key issues impacting intellectual and developmental disabilities community. A few examples of those key issues include ensuring adequate funding to local developmental disabilities programs, finding affordable housing for people with intellectual and developmental disabilities, and a continued emphasis on employment. For this appointment, we had 8 applicants and 5 vacancies. 3 applicants are seeking reappointment, with 2 new applicants being recommended for first-time appointment. We've invited all applicants to recent council meetings. The HHS department recommends the reappointments of Cindy Otis, Cindy Wilkins, and Deborah McKnight, and recommends the new appointments of Haley Myers and Erica Drew to the Developmental Disabilities Advisory Council. I put together a brief summary of each candidate, beginning with our applicant seeking reappointment. Cindy Otis is seeking reappointment for her second term with the DD Council. Cindy resides in District 1 and is a personal support worker supporting individuals and families with intellectual and developmental disabilities to be independent, thriving adults. Cindy has a particular interest in housing. She wants to ensure there are homes available for first-time home buyers, as well as subsidized or affordable housing options for people with developmental disabilities. Cindy is looking to serve in her second term. Cindy Wilkins is a second applicant seeking reappointment. Cindy resides in District 4 and is a parent of an adult experiencing intellectual and developmental disabilities. Cindy has worked in social services for over 20 years and is currently president of the Interfaith Disabilities Network of Oregon. Cindy is one of the few members of the council that has served for many years and is interested in an opportunity to serve another term to focus on continuity of services, funding, and employment for people with developmental disabilities. Deborah McKnight is a third applicant seeking reappointment. Deborah resides in District 4 and is a longtime advocate for people with intellectual and developmental disabilities. Deborah is also the grandparent of a child experiencing a developmental disability and would like to stay involved in the council to continue to provide input and ensure people with intellectual and developmental disabilities have a voice in Washington County. Haley Myers. Haley is one of our two new applicants recommended for appointment. Haley resides in District 1 as a community outreach and communications specialist with Imagine Possibilities in Aloha, which focuses on providing support to individuals with developmental disabilities in Washington County. Haley has participated in council meetings for the past several months and is excited to have the opportunity to serve on the council to continue her work advocating for a more inclusive community. Erica Drew is the second of our new applicants recommended for first-time appointment to the council. Erica is a parent of twins on the autism spectrum, a personal support worker, and co-founder of Portland Autism Moms. Erica also was previously employed with the Autism Society of Oregon. Erica would like to be appointed to the DD Council to not only share her passion for disability rights, but to be able to participate in meaningful work that benefits her local community and also appeals to her desire to serve individuals with developmental disabilities. Thank you for the opportunity to present our candidates for the DD Advisory Council. I'm happy to take any questions from the board.
Commissioners, is there any questions? I don't know where that weird audio came in, but so Colin, I'm having a real question about time of service or length of service. So I've looked closely at the first appointed and time expires. And frankly, you know, it's interesting to see that under our current members, we do have a member that served over 16 years. And this recommendation is to reappoint two members who have 12 and 15 years of service, which if we didn't have the beauty of additional interest left on the table, wouldn't necessarily bother me. But appointments are an art, not a science. Now, on one hand, I think, okay, if we're going to reappoint someone to a 6th 3-year term and a 5th 3-year term, as suggested, then that causes me to look at the two members that were first appointed in 2004 and 2006 and say, So can you tell me a little bit more about the level of thinking and care that went into deciding to keep two members who have 12 and 15 years of service and leaving on the table two other members?
Well, thank you for your question. That was a topic of discussion at several of our DD Advisory Council meetings. The council discussed the longevity of the two applicants that are mentioned in here, Cindy Wilkins and Deborah McKnight, and really felt that their contributions and historical perspectives from the council were important for the council moving forward. In particular, Deborah, as a identified self-advocate, Deborah speaks about disability rights frequently and provides a unique perspective to our council. Cindy Wilkins, as I mentioned, has been involved in social services, in particular connected with intellectual and developmental disabilities communities in Washington County and across the metro area for more than 20 years. With that said, I think that they are also prepared if the board chooses to proceed with one of the two or both of the other candidates that work under other applicants, then they are prepared for that as well.
Well, I haven't heard a message of other than general continuity, right? Given the mix of people who've been appointed from 2017, there's a 16, 17, a couple of 19s in 2020. I haven't heard about, there's some big strategic plan under development, so the continuities related to that. I mean, every legislative biennium, right, IDD or intellectually and developmentally disabilities is a topic of interest because the state has had such difficulty with funding on that. So I just don't understand the vital level. And at what point do we say, thank you very much, volunteers, for your long service? We need to ensure that we're making seats at the table for others who are stepping forward and wanting to contribute. So that's really where I'm coming from. I have no relationship or knowledge of any of these folks. And their level of volunteerism and interest is very appealing to me. So it's not a slam dunk. Any other thoughts?
Chair Harrington and board, this is Marnie Kyle, Director of Health and Human Services, and Colin has done a fabulous job of providing this overview for you. I just want to support that these are our recommendations, and some of our recommendation comes from our work with the advisory committee, but we are very interested in your thoughts, and this is really your appointees to make. And whatever we can do to support you in getting more information about some of the other applicants, or if you have other applicants that you found interesting that you'd like to be considered, we're happy to do that. And I think I'm happy to work with this advisory committee around looking, as we've done with other advisory committees, looking at the bylaws and considering these kinds of questions. We just haven't done this with this particular advisory committee yet.
Well, and I see that in the applicant pool, we do have a bicultural member that is an advocate, yet we're not taking advantage of that demographic expansion and instead are once again reappointing a long-term advocate instead. It just seems like a loss. We're leaving an opportunity on the table. But anyway, I've already said my piece, sorry. Commissioner Willie, go ahead.
Well, and I certainly understand that, I guess, that thought process. But in looking at this, there's 15 members on this board. 11 of them will have been appointed from 2016 or sooner. And I firmly believe that as we go through this process of transition and making the opportunity available to a broader spectrum of community members and things like that, it's also important that we maintain some history and some balance and some expertise on there from previous. So I realize that the 4 that are staying, that are still on there, have been on there a pretty considerable amount of time. I still believe 11 reasonably recent folks, and I didn't break it down between how many of 19 and 20, but there's a good portion of them, 1, 2, 3, 4, 5, 5 of those folks since 2020 and 2018 and 2019. So again, I believe as we do this, I'm just an advocate that we maintain a good constant flow of seniored folks and new folks. And so, like I said, out of the 15, 11 of them have been since 2016. And I think that's a good blend. So I'm comfortable with the recommendations that they're making, although your perspective and conversation certainly is noted. And I think we will certainly be able to continue to make those transitions as we move forward.
I was going to almost make those exact sentiments. So I guess I will just say I don't disagree with Commissioner Willie. I'm comfortable.
Yep, I agree with you. But for really trying to push forward on operationalizing racial equity and inclusion, therein lies the rub. So I think it will stay tuned to see for those seats that are up for reappointment in 2022, which amazingly is just around the corner. We'll see if any of them choose to not re-up, and maybe we'll have an opportunity to once again consider Jocelyn and Stephanie.
And I think that's an excellent point, Chair. 2 of the long-termers are up for February 22, and as much as we'd like to think that's a long ways off, it really isn't.
Right.
And so, yeah, and again, that would also give us the opportunity to say to these folks who have spent a long time on this and contributed a considerable amount of their personal support to this, that we could say, we're probably looking at a transition in this, and that's where we're going. It's a little bit of a heads up and a little bit of advance notice, and it is only 8 months from now or 10 months from now or something like that. That would be my preference.
Yeah, I just needed to discuss it. Go ahead, Commissioner Treese.
Also in the staff's spare time, and that is I understand there's precious little of that. We probably should have a discussion about where these committees should have a term limits, so that we have a better structure in terms of and a clearer understanding on the participants' part. You know, I think that it's appropriate in some cases. It may not be appropriate in others, and I also fully respect the fact that we have limited, you know, there are a lot of these committees and advisory councils. So, you know, I don't think that fits every group, but it's something that we should consider. Maybe that's something we ask each of our advisory councils to consider in the future.
Well, at least now we're giving them the opportunity to share demographic information. Commissioner Fye, any thoughts?
I think you raised a really good point, Chair. I think especially if we're gonna internalize the equity resolution and really operationalize, I think you raised a good point to really think about giving new folks a chance to contribute to the county system and to our practice and policies. I think if we miss this opportunity, I think I agree with Commissioner Willie and looking into and you for the next two in the 2022, because I think it doesn't seem right if we were to go back and say, you know, I feel comfortable moving forward with this and keeping in mind that in 2022, we will reconsider giving new members a chance, whatever that means.
So Chair Harrington and board, it sounds like there's consensus to bring back this current slate, but we will also commit to having a discussion with the current advisory committee about the bylaws, including term limits, and get their input also on how we can increase diversity, similar to what we've done in other HHS advisory committees. So, okay, I'm seeing lots of heads shaking. So
sounds great.
Yeah, really appreciate your input and thoughts on this. Thank you. And Colin, thank you. You did great.
Yes.
Just
thank you for your input.
supported.
I appreciate it. Yes, thank you.
Yeah, we're all learning together. We're on
Yes.
the journey together.
Thank you.
Terrific. All righty. Well, we're a little bit behind time. So the last item on our agenda is an executive session. Are there any last items that we need to highlight before we entertain going into exec session?
I would certainly like to have about a 5-minute
break.
How do you call it? Bio break? Yeah, whatever. Yeah.
Yep. So, okay, do we have a motion to move to executive session pursuant to ORS 192.660 sub 2 sub H, which, if I had my notes in order here, which I do, is to consult with counsel regarding the legal rights and duties of a public body with regard to current litigation or litigation likely to be filed after a 5-minute break. So let's come back at 4:47.
So moved.
Second.
We have a motion and a second. All those in favor, please vote by saying aye or raise your hand. Thank you, commissioners. Any opposed? The motion carries unanimously 5-0. So we'll see one another on the executive session link at 4:47 or somewhere thereabouts. Thank you.